Whether you're in the acute or chronic stages of nerve damage, Utah Facial Plastics has treatment options for both. Dr. Henstrom joins me now to explain the causes and the treatments. He does all the good stuff, the facelifts, the eye lifts, the Botox, the fillers, all that stuff. But we're talking about facial nerve damage today. Why are we talking about that today?
Yeah, it's a good point. You know, Dr. Thompson and I come on here frequently, talk about the aesthetic options for people with face and neck, things that they want to change. But one of our passions is the reconstructive options that we offer patients for different things on their face and neck. And one of the things I have a passion for and have specialty training, quite frankly, there's not a lot of people in the country that treat comprehensively patients with facial paralysis. This is a patient group that sometimes gets neglected because there aren't a lot of known treatment options out there, but I'm here to tell you that there are. We offer them at Utah Facial Plastics. I have a lot of training in this, a lot of specialty and expertise and interest in helping these patients.
What causes facial nerve damage?
Yeah, great question. You know, if you open up a textbook, you'd see a page with a lot of things listed. But the most common things that are going to cause facial paralysis that people are most familiar with, viral-mediated diseases like Bell's palsy, Ramsay-Hunt disease. People have surgery on their parotid gland right here where the facial nerve comes through their face and their facial nerve may get damaged because of that.
Okay.
Intracranial problems. There can be trauma, you know, things from accidents that can cause facial nerve damage. Intracranial tumors. Acoustic neuromas are probably the most common types of intracranial tumors that cause this. When I did a study on the facial reanimations that we did on kids back in Boston, we found that the kids that are getting facial reanimation options most commonly are affected by brain tumors.
Oh, wow.
And they have surgery, then they have radiation, and it knocks out and it damages their facial nerve. So lots of different causes.
Well, and you also have acute and you have chronic. What's acute nerve damage?
So in the early stages of facial nerve damage, you may be worried about certain factors. Now, most people who get facial nerve damage will actually heal up and do fine in the end, but a percentage of these patients won't heal up. So in the acute stages, patients can see their primary care doctor, their neurologist, their ear, nose, and throat doctor, and get treated with steroid medication, antiviral medication to help the swelling on the nerve go down, to help decrease the long-term ramifications of this nerve damage.
Okay.
Sometimes in the acute stage we might do other things. We're really concerned about people's eyes because they don't close well when patients have facial nerve damage.
Right, and that can be dry and all of those things too.
Right, so we might actually put a weight in the eye to help close it and so forth.
Okay, and then what about the chronic?
Well, chronic options, here's a picture of a gentleman who had facial nerve damage, and one of the things that we offer are facial reanimation procedures. So you can see a lot of focus is on the smile, and here's a person who can't smile, but after what we call a temporalis tendon transfer procedure, he can smile. Here's another patient.
Look at this.
Here's a patient who has a neurofibromatosis type 1. He can't smile. That left facial nerve is completely out, and we do a single-stage gracilis muscle transfer to help him so that he can smile and reanimate.
Gosh, how life-changing. Does that feel so good to do that?
Absolutely. This is so rewarding. Here's a couple examples. That last picture in this patient who actually we use Botox. So this is a patient who when she smiles, her eye involuntarily closes really tight. If we use Botox in the right place and the right amount, we can open up that eye. She can see better, she can talk better. Here's a young man who was actually born with what's called Mobius syndrome. It's very rare, but it causes the facial nerve to not develop. So he can't smile at all. That before picture is actually him attempting to smile. He can't move anything. So we do a bilateral surgery in 2 different stages to put a muscle up there, hook it into a nerve, hook it into an artery and a vein to keep it alive, and give him a smile back. And the differences are not just what you see, but how they feel, because the nonverbal communication in facial paralysis is a big part of what affects them long term. So helping them be able to do this helps them with their nonverbal communication. It can help them with their oral competence, eating and drinking. If you could think in public how that might be a real detriment to wanting to go out.
And their self-confidence.
Yeah, absolutely.
Well, I love that you have the expertise to be able to do it. Utah Facial Plastics, that's the phone number. We'll put all the information on our website. You are changing lives. I love it, Dr. Henstrom.
Absolutely.
Thank you for being here today.
My pleasure.
Coming up, no alterations, see 3 thrifty thread looks that you can wear